Aydın is a professor and the rector of Istanbul University Cerrahpaşa campus. He joins us live now from Istanbul. Professor, thank you for joining us on the program. Talk to us first about the latest situation in Turkey. We are seeing increasing deaths here in Turkey, but this week Turkey said it had reached the peak of the virus. So what can we expect to see over the next few weeks?
Actually, at the moment that we are now having is a stable condition as expected before. But the peak point, what is the peak point? We will see it in the next week maybe. But now the condition is very stable, especially in my hospital. If I give you an example, this is one of the leading university hospitals in Turkey, serving for about 200 years. We have last week. We had a peak in the number of the patients, both the ICU units and for the wards. But this week, the number of the patients in the ICU units decreased by time. We can realize this by ourselves. So the condition is in this position now.
In other countries, we've seen situations where hospitals are overwhelmed, healthcare workers are overwhelmed. What is the situation across Turkey in hospitals, in particular in ICUs, where the people who are most critical are being treated?
I believe one of the advantages of Turkey in this condition is there are new built hospitals, huge hospitals now in every cities. So these hospitals helped us very much indeed. To give an example from my hospital, we closed down our normal operating rooms and we turned our operating rooms into ICU units. Actually, they're not full now. We are almost half of them is full. So we are ready for that. For especially some public hospitals, which are run by the Ministry of Health, they are all ready for this type of COVID pandemic.
What line of treatment is given to patients who come to your hospital or other hospitals in Turkey when they are sick with coronavirus? What's the treatment that's given to them?
Actually, there are different types of treatments which were popularized very much in the past. One of them is a hydroxychloroquine treatment. This treatment first was used in intensive care units in the world, but in Turkey, we started this treatment before the intensive care unit patients. That's why I believe the number of patients in the intensive care units decreased by time. There's another thing that another technique is being used. We started to lay in prone position in this patient. It means that the patient lays face down on the bed. So this increases the lung capacity. So in such conditions, this is helpful for the patients before the intensive care unit. The other thing, which is a new treatment actually, is a high frequency oxygen treatment for these patients before the ICU units. When the patient is in normal ward, we apply high frequency oxygen treatment for these patients, and it's really helpful for the patients before going to the ICU units.
What's the situation like for healthcare workers? Of course, we know that they're the ones on the front lines fighting this virus. They're putting themselves at risk. In other countries, we've seen people, who have fallen ill, health workers, nurses, and doctors. What's it like for these healthcare workers here in Turkey?
Yeah. Actually, for about 4 weeks, in a day of a week, every week, I visit the wards, I visit the intensive care units. My point of view, I saw that in my first week, the medical staff, the doctors, the nurses were actually somehow in a panic. At the second week, they got used to that condition. They were much more prepared. They feel better. At the third week, I saw my staff in a very good condition. They were perfect in terms of the medical treatments, and they don't have panic actually. They don't feel that they're working in a panic condition. They were all stable. So this is good, I think.
Okay, we'll leave it there. Professor Nuri Aydın, thank you so much for taking time to speak with us today.